Hello and welcome to this section on supplementation. So just a little definition for you: the supplement, to add an extra amount to, that's the definition. And I think it's important to remember what the word supplement means. It is to add an extra amount or to add to. So nutritional supplements, whether taken in tablet, capsule, liquid form, herbal, or indeed certain foods which are actually used as a supplement, should not be thought of as a replacement for a varied, balanced diet. They are there purely to supplement, exactly as the name suggests. Of course, in terms of health, it can mean to boost a deficiency, especially in later life, or to help with an illness or condition, and in fitness to improve performance. The majority of supplements are micronutrients, but some are macronutrients and trace minerals, you might remember from previous modules. Types of supplements. Some popular supplement types are vitamins, minerals, amino acids, fatty acids, proteins, glucosamines, herbal supplements, and botanicals, and all the branches of these. There's lots of different branches coming out of those that I've just mentioned. You'll find most of these are available in either tablets, capsules, gummies, liquids, and powders. So, how do you know what to choose? This is a very difficult question, and it depends on what the individual wants to gain from supplementing. It could be as simple as a multivitamin to supplement a busy life, or a woman who is premenopausal and is looking to try and counteract the changes that are going to be happening in her body. It could be simply that the person has read somewhere that a certain supplement may be effective in preventing certain diseases and wants to start taking it. So it's totally individual. All supplements will have one or more uses and benefits, so research is the key. So why supplement at all? Whilst it can be argued a full balanced diet can and should provide all the vitamins and minerals we need, there are other facts to consider. Modern busy lives often mean that people don't have time to prepare meals from fresh as much as they would like. We've all grabbed something that's pre-made or processed. Once we start processing any sort of food, then it will reduce its value of nutrients. Also, the nutrient value of practically all of our vegetables and fruit has gone down in the past 60 years due to demand and a growing population. As plants have been genetically modified to provide faster and higher yields, the nutrient values have dropped. So what do supplements help with? For a more in-depth look at what vitamins and minerals and trace minerals do in the body, you can refer back to the micronutrient module and where I listed the vitamins and what they do within the body, and then you just transfer that onto supplements. However, taking just two popular supplements, you'll see their uses, benefits, and possible side effects if taken without proper consideration. You'll also see the link between the two that you are probably unaware of. So what I've done, I've chosen two here. The first one being calcium. Calcium is used in the body to build and maintain healthy bones, and within the bloodstream, it's used to send nerve signals, regulate hormone release like insulin, and it helps regulate how muscles and blood vessels contract and dilate. Recommended for anyone who is possibly deficient, and especially to help with effects of osteoporosis in later life, or somebody suffering with a condition that affects absorption of calcium, such as Crohn's disease or IBS, irritable bowel syndrome. Also for postmenopausal women to help with bone loss. The warnings: daily limits of 2,500 milligrams daily for the under 15s and 2,000 milligrams for the over 50s. High dosages may increase risk of heart disease. High levels may be linked to also prostate cancer, an increased risk of kidney stones, and hyperglycemia, which is high levels of calcium in the blood. Okay. Vitamin D. Vitamin D is vital for proper calcium and phosphorus absorption, normal growth of bones and teeth, helps resistance against certain diseases, and is key in helping fight depression. It's recommended for anyone who is not getting enough sunlight, for their skin to produce vitamin C, anyone who is at risk of weak bones, anyone who is taking calcium supplements. Sometimes vitamin D is called the sunshine vitamin. So generally speaking, anyone in northern countries where the winters can be quite dim in terms of natural light. The warnings on the vitamin D is taking too much vitamin D can cause weakness, nausea, vomiting, dry mouth, and too much over a period could cause too much calcium in the blood. But you can see here where the two, calcium and vitamin D, are linked together, because without the vitamin D, the calcium and the phosphorus won't be absorbed into the body properly. So this is why a little bit of research or talking to somebody about it will give you the best outcome if you're choosing supplements. So to conclude, is there a need for supplements? Absolutely yes. and the previous slides have shown there is more than one need for them in our modern lives. Just to be sure to do some research, and if in doubt, ask someone qualified to help. Make sure the supplements you choose are of good quality and the correct strength and dosage for what you need them for. There's a very key thing you will find on the market. You can just look on the internet, massive variations in the amount and the dosage and the strength, okay? Especially now with the open market where you can buy things from all over the world. Also, remember, too strong can be dangerous and too weak will do nothing much at all. So do some research, and thank you very much for listening, and I shall speak to you in the next module.